Hello, continuing this series of informative videos covering necropsy and sample collection from swine, Pharmabasi, as part of our commitment to animal health, has invited a pathologist who is a specialist in swine health to present this specialized technical content in a practical manner, so that you, as a veterinarian, can be more assertive in diagnosing swine diseases and in making decisions regarding disease control. In today's video, Dr. Marcos Moraes from Embrapa Swine and Poultry will share techniques for evaluating and collecting samples from the locomotor system, skin, and appendages of swine. Dr. Marcos, the floor is yours. The correct diagnosis of problems in the swine's locomotor system can be obtained in most cases from proper clinical evaluations in conjunction with a necropsy of the affected animals. However, in some situations, it is important to collect samples for laboratory analysis. Infectious and non-infectious diseases can affect the locomotor system, causing difficulties in locomotion with consequent economic losses due to damage to the zootechnical indices, increased mortality, and increased expenditures for medication. In the macroscopic evaluation of the joints, the normal articular cartilage should be bright with a whitish coloration containing a small amount of clear and transparent or slightly yellowish synovial fluid, and the synovial membrane should not be protruding when the joint is opened. Although less frequently encountered, nutritional imbalances of calcium, phosphorus, and vitamin D can cause changes in the ossification process, inducing pathologies such as fibrous osteodystrophy, osteomalacia, and rickets. The primary clinical feature of these conditions is bone fragility, which can be evidenced by frequent fractures. Bone fragility can be identified during necropsy by breaking a rib, which should snap when broken. If there is a green stick fracture, that is an indication of fragility due to problems in ossification. In cases of rickets, one can also observe the thickening of the costochondral cartilage, the so-called rachitic rosary. Infectious arthritis and polyarthritis are clinically identified by joint thickening and claudication in affected animals. The most frequently involved agents are Glycerella parasuis, Mycoplasma hanociviae, Erythropelothrix ruseopathiae, and Streptococcus spp. In infectious arthritis, there is always a reaction in the regional lymph nodes, specifically the axillary of the first rib for the thoracic limbs and the medial and lateral iliac crests for the pelvic limbs. The synovial fluid shows an increase in volume and density, and its color is altered. In cases of Glycerella parasuis and Streptococcus spp infection, the synovial fluid is suppurative or fibrinous. In cases of Mycoplasma hanociviae infection, this synovial fluid shows an increase in volume with the presence of blood, and additionally there is moderate hypertrophy of the synovial membrane. Erysipelas arthritis is usually chronic and characterized by marked hypertrophy of the synovial membrane with erosive lesions in the articular cartilage and a severe reaction in the regional lymph node, which often includes the formation of vesicles in the lymph nodes. Osteochondrosis, a common type of non-infectious arthritis observed primarily in fast-growing swine in the growth and fattening phases, induces a sharp increase in the volume of synovial fluid with the presence of blood. The primary difference between infectious arthritis types and osteochondrosis is that in the latter there is no reaction in the regional lymph nodes. Osteochondrosis occurs most frequently in the humerus radioulnar joints, and most often the lesion is bilateral. In the articular cartilage, lesions such as folds, flaps, or ulcers are observed. The collection of samples for the diagnosis of the agents causing the arthritis is performed with the aid of swabs or sterile syringes. Antiseptic measures should be taken when opening the joint to avoid contamination by external agents. With a clean knife, the skin and tendons are cut without severing the joints. Then the joint is forced open without using the knife. This procedure greatly reduces the chances of contamination. Collection can be done with a syringe without opening the joint, reducing even further the chances of contamination. These samples may be used for bacterial isolation or PCR testing. In cases with suspicion of bone fragility, fragments of long bones and ribs can be collected in formaldehyde for histopathological analysis. When discussing skin diseases, infectious diseases are the most frequent cause of skin lesions in swine, and this can increase mortality and production costs when not properly diagnosed for more specific control. Exudative epidermitis, or moist eczema, affects piglets in the farrowing and weaning phases and is caused by Staphylococcus aureus infections. The generalized form of the disease is observed as a change in the color of the skin, which becomes darker and greasy looking, with an unpleasant odor and the formation of dark scabs. These lesions usually appear first around the snout and eyes and then spread. The infected piglets become listless, crowd together, and may develop diarrhea and emaciation. In the localized form, the lesions are circumscribed, multifocal, covered by scaly scabs, located primarily on the back and the sides of the neck. During the necropsy, in addition to skin lesions, the subcutaneous lymph nodes of the affected areas are hypertrophied, and the kidneys may also be enlarged, with the presence of urates and cysts. Clinical diagnosis is frequently sufficient, but in some cases it is important to confirm it through bacterial isolation and histopathological analysis. In these cases, recommended practice is to collect samples of the lesion's skin, approximately 2 cm square in size, in addition to tissue samples from the kidneys and subcutaneous lymph nodes in formaldehyde for histopathological analysis. For bacterial isolation, swabs of the affected skin can be sent. However, as the skin is quite easily contaminated, the best samples would be tissue from the subcutaneous lymph nodes of the affected areas, shipped refrigerated to a laboratory. Sarcoptic mange, caused by Sarcoptes scabiei suis mite, is one of the predominant skin diseases in swine. Although infestations are easily controlled, when they occur, significant damages can result due to carcass condemnation in abattoirs, in addition to zootechnical damage. The disease can affect animals of all ages. The clinical profile includes hypersensitivity to the mites and evolves into intense itching, erythema, alopecia, and scabbing on the skin. The affected skin becomes thickened, reddish, and scaly. The chronic form of the disease is most frequently observed in breeders, located primarily in the pinna, around the eyes, neck, and axillary region, appearing as loosely attached scabs. Mange diagnosis may be presumptively clinical, but confirmation may be necessary. In such cases, the collection of skin scrapings from affected areas is recommended for microscopic examination, particularly samples from the pinna, where the highest concentration of mites is present. Deep scrapings using scalpels and mineral oil should be collected. The samples should be packed in clean plastic bags or bottles and shipped to a laboratory at room temperature or refrigerated. Porcine circovirus type 2 infections have a clinical profile including dermatitis and nephropathy, which also occurs as skin lesions in affected animals. This disease is more common in animals in the growth and fattening phases, and the skin lesions are multifocal, rounded, about 2 cm in diameter, shaped as an erythema, progressing to the formation of brown scabs. These initially appear on the posterior and lateral sides of the legs, and later appear on the ears, scrotum, and vulva. Often these lesions have an hemorrhagic appearance and a very dark color. The affected animals become emaciated, and during the necropsy, in addition to skin lesions, severe kidney lesions are observed. The kidneys are enlarged in size and contain multifocal petechae on the capsular surface. This is an immunocomplex lesion which may have other causes besides PCV2 infections. The diagnosis can be confirmed by a combination of histopathological and immunohistochemistry testing. To this end, samples should be collected from skin lesions, kidneys, spleens, mesenteric, and inguinal lymph nodes and preserved in formaldehyde. Vesicular diseases also cause lesions in porcine skin, and their importance is primarily related to a differential diagnosis of foot and mouth disease. In recent years, Seneca virus infections have been frequent in Brazil, causing significant issues concerning this differential diagnosis, particularly in abattoirs. Whenever clinical vesicular diseases are identified in swine, the animal health authorities must be notified, as they are responsible for referring the situations to differential diagnosis procedures. In addition to Seneca virus infections and foot and mouth disease, porcine vesicular disease, vesicular exanthema, and vesicular stomatitis are all viral diseases whose clinical profile includes vesicular lesions, which may require laboratory diagnosis to differentiate because the lesions and clinical conditions may initially be similar. Vesicular lesions appear primarily in the snout and coronary band of the hoof. They begin as whitish areas on the skin and evolve to vesicles containing clear liquid, which break rapidly, forming scabs of necrotic material. The diagnostic material is the vesicular liquid or the skin containing vesicles from an animal in an acute condition before the formation of necrotic scabs. This material should be shipped in a refrigerated container to the laboratory for viral PCR identification. Systemic erysipelosis rhusiopathiae infections in acute cases of swine erysipelas produce very distinct skin lesions, which are geometric multifocal areas, usually in the shape of lozenges spread throughout the skin. The lesions are elevated in relation to normal skin, pinkish to reddish in color, and can evolve to a purple coloration with necrosis of the skin forming peeling scabs. These diseases affect mainly breeders and fattening animals, and high body temperatures are observed in the acute phase of the disease. Clinical diagnosis is usually accurate due to the distinct characteristics of the lesions, but in cases requiring laboratory confirmation, if a necropsy is performed, or for animals that arrive at the abattoir with indicative lesions, it is recommended that refrigerated samples of the spleen and affected areas of the skin be submitted for bacterial isolation or PCR testing. Skin samples can be submitted for histopathology testing since the microscopic lesions may be compatible, but they are not specific. Our next video will address the porcine respiratory system.